Good morning or good afternoon. My name is Nikolai. I'm a shareholder in BBU Pharmaceuticals. Basically, I would like to say a couple of things. There are only 4 types of drugs that are used to treat Parkinson's disease. And only one drug is considered to be the golden standard of drug therapy for Parkinson's. That drug is called levodopa. It was discovered about 60 years ago. And since then, there haven't been too much improvement. We developed a drug that offers great improvement over the existing drug therapy for levodopa. It actually shows a lot fewer side effects because the mechanics are different, and it has additional therapeutic benefits that levodopa does not have. To put it into perspective, about 1% of people above 60 years of age suffer from Parkinson's. That puts the figure about 4 million people worldwide. The market is about $4 billion and is growing. Aging population is going to drive the number of people afflicted with Parkinson's even higher. So basically, our drug will provide a better quality of life for patients. We finalized R&D stage, and we're entering preclinical trials. That's what we need the money for. We are planning to conduct preclinical trials in Germany or in the United States. We have ongoing discussions with clinical and preclinical providers in both places. Our team combines both, business acumen and very strong science. The product that we have is a product of 40 years of research into biophysics and biochemistry. And basically that says it all. I mean, we've got science, we've got radioisotopic studies, we have lab work completed, and so we're entering now into preclinical stage, and we're planning to disrupt the market for Parkinson's disease drugs. Thank you very much.
Thank you. Thank you, Nikolai from BBU Pharmaceuticals. Do we have any questions from the judges?
Yeah, this is Gregory from Geo Holding in Ocean Bridge. When you say preclinical, are you in mouse models, or where are you in the testing and analysis?
We are at the preclinical stage. We've done radioisotopic studies on mice. We've done so-called physiological studies on mice as well. We've run certain things on voluntary patients with consent, but we need to do the proper preclinical trials.
And how much money do you need?
We need $2 million to do preclinical trials on the drug, and we have a soft commitment of about $500 already. So we're looking for about $1.5 million.
How long do you assume the clinical trials and the whole acceptance process takes? Can it be like 5 years, 10 years?
Well, preclinical trials, according to the schedule we have from the lab in Germany, it's going to take us about 18 months to complete the program. And when we talk about the roadmap for monetization, we want to basically go to the clinical stage 1 and 2 and monetize through a trade sale after clinical stage 2. We've got some ongoing discussions with Big Pharma, and there is some interest. I mean, there is a strong interest in a space, but of course, all Big Pharma, they want to take a look at the toxicity, that preclinical thing.
So basically your plan is to do an exit before you have a product in the market?
Well, actually, yes. It's a typical stage for venture capital because we can't really go for 10 years investment. That's very difficult.
And where are you located, and where universities come out of?
Well, we're not at the university. Basically, as we usually say, the brains are in Germany because the person the science director lives in Germany, in Berlin. Mm-hmm. I'm located in Moscow. And the CEO is traveling between Canada and Moscow. So in that sense, we've got entities both in Russia and outside Russia. So we're pretty flexible where we want to do, and we're very lean on structure. Our OPEX is less than 10% of the total capital requirement we want.
And intellectual property?
Yes, we filed 2 PCT patents in Germany, and we want to do in the national stages. And that is something that we're going to be funding from this round. It's about $50K.
And you guys did a freedom to operate?
Pardon me?
Did you do a freedom to operate? Like, did you have someone make sure that you're able to, that you're not infringing on other patents already?
Yes, I mean, actually, we have lawyers, and we did some patent landscape work on that as well. So let's say it's a stream of science that has been exclusively conducted by our scientific team. So there are very few streams of science.
Okay.
Thank you.
Thank you.
Thank you, Nikolai. Thank you, BBU.